I'm making toast strong?
You could be, Devin. You need to be careful.
Good health now. New numbers on the death rate from cervical cancer are out tonight, and they suggest a more significant risk for all women, but especially women of color.
Dr. Frank McGeorge is here to explain why the numbers are worse and how women can stay healthy.
Well, Karen and Devin, here's the reason why. Many studies looking at the risk of death from cervical cancer failed to exclude women who have had a hysterectomy, who basically no longer have a cervix. When you take that into account, the numbers look very different.
A study published today in the journal Cancer recalculated the cervical cancer mortality rate in the U.S. and finds when you exclude women who have had a hysterectomy, the death rate for white women increased 46%, and the death rate for black women jumped 77%, which means the overall death rate from cervical cancer for black women is more than double that of white women. Black women over 85 were at the highest risk at more than 3 times the already high rate for black women in general. On an encouraging note, for women aged 20 to 29 and 35 to 39, there was no racial difference in mortality. Now, years ago, cancer of the cervix was one of the leading causes of cancer death in the U.S., but now, thanks to improvements in screening and the introduction of the HPV vaccine, cervical cancer is one of the most preventable forms of cancer. 99% of cervical cancers are caused by only a few strains of the human papillomavirus, or HPV. Unfortunately, many people are opting not to vaccinate their children, to the dismay of many gynecologists.
Why would you prevent them from, why would you stop them from having something that can prevent a catastrophic cancer that kills young women?
Even if you have had the vaccine, regular screening for cervical cancer is also important. Screening means a pap smear and in some cases a test for the human papillomavirus.
Now, just so there's no confusion, for women who have had hysterectomies, there are some situations where cervical cancer screening may still be necessary, and women need to discuss that with their doctors. Now, finally, the researchers speculated that the reasons for the racial disparity in cervical cancer mortality includes differences in access to screening, a lower rate of screening, and a difference in one particular type of cancer.
It's interesting because you were just saying that some women who've had hysterectomies may feel like they don't even need an OB/GYN anymore.
Right.
And that's not the case.
Exactly, because oftentimes when we do a hysterectomy, we leave the ovaries behind, and of course that's still something, and sometimes a little piece of cervix is also left behind. So there's a lot of reasons to still see your OB/GYN even if you've had a hysterectomy.
Thanks,
Right,
Doc.
Doctor.